I want to talk to you today about something that works quietly in the background of your health, that a great many older adults are short of without knowing it, and that matters more in later life than most people realize. Vitamin D and its connection to the silent loss of bone strength that can leave you vulnerable to fractures. You can't feel your vitamin D level, and you can't feel your bones gradually weakening, which is exactly the problem, because both can decline silently for years, with no symptoms at all until something goes wrong. A fracture from a minor fall, a bone that breaks too easily. So, today I want to explain what vitamin D does, why older adults so often run short of it, why it and bone health matter so much in later life, what the silent bone loss called osteoporosis is, and why it's so dangerous, and, most importantly, what you can do to protect your vitamin D, your bones, and yourself. And I'll keep this calm and practical, because while this is genuinely important, there's a great deal you can do to protect your bones and get the vitamin D you need, and the key is to act before a fracture, not after, since so much of this is preventable. Let me start with what vitamin D does, because understanding it shows why it matters so much. Vitamin D plays several important roles, but its most crucial job is helping your body absorb calcium from your food and use it to build and maintain strong bones. So vitamin D is essential for bone health, working hand in hand with calcium, the main mineral your bones are made of. Without enough vitamin D, your body can't absorb and use calcium properly, so your bones can't be properly maintained and can weaken, which is why vitamin D deficiency contributes to weak, soft, or brittle bones. Beyond bones, vitamin D is also involved in muscle function, and a deficiency can contribute to muscle weakness, which, combined with weaker bones, raises the risk of falls and fractures. So, vitamin D matters for both your bones and your muscles, and thus for your strength and your protection against fractures. There's also growing interest in vitamin D's roles in immune function and elsewhere, though its bone and muscle roles are the most established and most relevant here. So, vitamin D is essential for absorbing calcium and maintaining strong bones, and for muscle function, which is exactly why a deficiency, common in older adults, matters for your bones, your muscles, your strength, and your risk of falls and fractures. Let me explain why older adults so often run short of vitamin D, because it's surprisingly common and the reasons point to the solutions. Vitamin D is unusual in that your body can make it in your skin when exposed to sunlight, and you also get some from a few foods. But several things make deficiency common in older adults. First, as we age, our skin becomes less able to make vitamin D from sunlight, so older skin produces less, even with the same sun exposure. Second, older adults often get less sun exposure, spending more time indoors, covering up, or being less mobile, so they make less vitamin D. Third, vitamin D is found naturally in relatively few foods, mainly oily fish, egg yolks, and some fortified foods, so it's hard to get enough from diet alone. Fourth, those who live in less sunny climates or who spend winters with little strong sunlight make little vitamin D for much of the year. Fifth, certain conditions and factors affect vitamin D. So, because aging skin makes less vitamin D, older adults often get less sun, few foods contain it, and climate limits sun exposure, vitamin D deficiency is genuinely common in older adults, often without any symptoms. And the important point is that this common silent deficiency can be readily identified and corrected, which is exactly why it's worth attention. So, vitamin D deficiency is common in older adults for understandable reasons. And the good news is that it's easily addressed once recognized. Now, let me explain the silent bone loss, osteoporosis, because this is the danger that vitamin D and bone health are really about. Your bones are living tissue, constantly being maintained, and their strength depends on having enough bone mass and density. As we age, and particularly in women after menopause, we tend to lose bone density, so the bones become less dense, weaker, and more fragile, a condition called osteoporosis when it's significant, literally meaning porous bones. Here's what makes osteoporosis so dangerous. It is completely silent. Bone loss causes no symptoms at all, no pain, no signs, nothing you can feel, so it progresses silently for years, and the first sign is often a fracture, a broken bone from a minor fall, or even, in severe cases, from minor stress that wouldn't have broken a healthy bone. So, osteoporosis silently weakens your bones until they break too easily. And the fractures it causes, especially of the hip, spine, and wrist are genuinely serious. A hip fracture in an older adult, as I've discussed, is a grave event that can lead to loss of independence, lasting disability, and serious decline, and is one of the most feared consequences of falls. Spine fractures cause pain, height loss, and a stooped posture. So, osteoporosis matters enormously because it silently weakens your bones, with no warning until they fracture. And those fractures, especially hip fractures, are among the most serious threats to an older person's independence and health. This silence is exactly why you must act before a fracture, by protecting your bones and identifying bone loss rather than waiting for a break to reveal it. Let me connect this together because vitamin D, calcium, bone health, and fall prevention all work as one picture. Strong bones that resist fracture depend on adequate bone density, which depends on getting enough calcium, the building material, and enough vitamin D to absorb and use that calcium along with the other factors that maintain bone. And avoiding fractures depends not just on bone strength, but on avoiding the falls that cause most fractures, which depends on the balance, strength, vision, and home safety measures I've discussed. And vitamin D contributes here too, through its role in muscle function. So, protecting yourself from the serious fractures of later life means both keeping your bones as strong as possible, through calcium, vitamin D, and the other bone-protecting measures, and preventing falls through balance, strength, and safety. Vitamin D sits at the heart of this, supporting both bone strength and muscle function. So, the way to protect against the silent danger of weak bones and the fractures they cause is a combined approach. Nourish and protect your bones with calcium and vitamin D and the other measures, and prevent the falls that turn weak bones into broken ones. Let me give you the practical steps for both. So, let me give you what you can do to protect your vitamin D and your bones, because there's a great deal within your power. First, vitamin D. Because deficiency is so common and hard to avoid through sun and diet alone in older adults, many older adults benefit from a vitamin D supplement, and this is commonly recommended. So ask your doctor whether you should take a vitamin D supplement and at what dose, and whether your vitamin D levels should be checked with a simple blood test, since this is the reliable way to address the common silent deficiency. Get some safe sun exposure when you can, which helps your skin make vitamin D, while being sensible about sun protection and skin safety. And include vitamin D food sources like oily fish, egg yolks, and fortified foods. So addressing vitamin D, often through a supplement on your doctor's advice, plus safe sun and food sources, is a key, easily done step. Second, calcium. Get enough calcium, the building material for bones, from your diet, with good sources including dairy, like milk, yogurt, and cheese, fortified foods, certain green vegetables, tinned fish with soft bones, and others. And if you can't get enough from diet, your doctor may advise a supplement, though it's generally best from food where possible. So, adequate vitamin D and calcium together are the nutritional foundation of bone health, with vitamin D often needing a supplement in older adults. Let me give you the rest of the bone-protecting and fall-preventing measures, because these complete the protection. Beyond calcium and vitamin D, protect your bones with weight-bearing and strengthening exercise, because, as I've discussed, exercise that works your bones and muscles, like walking and strength training, genuinely helps maintain bone density and muscle strength. So staying active and doing weight-bearing and resistance exercise is one of the best things for your bones as well as your muscles. Not smoking, since smoking weakens bones. Limiting alcohol, since excess harms bones. And maintaining good general nutrition. And very importantly, prevent the falls that cause most fractures through everything I've discussed. Balance and strength exercises, good vision and footwear, home safety with lighting, grab bars, and removing hazards, managing the dizziness and medications that cause falls, and so on. Because preventing falls is just as important as strong bones in avoiding fractures. So, weight-bearing and strengthening exercise, not smoking, limiting alcohol, good nutrition, and diligent fall prevention all protect you from fractures alongside the calcium and vitamin D. The combined approach, strong bones plus no falls, is what truly protects you. Let me tell you about identifying bone loss, because since it's silent, finding it before a fracture is key. Because osteoporosis is silent, the way to know if your bones are weakening before a fracture reveals it is through a bone density scan, a simple painless scan that measures your bone density and can identify osteoporosis or its earlier stage. Talk to your doctor about whether you should have a bone density scan, which is often recommended for older adults, especially women after menopause, those with risk factors, and those who have had a fracture from a minor fall. This matters because, crucially, if bone loss is identified, there are genuinely effective treatments. Alongside the calcium, vitamin D, exercise, and lifestyle measures, there are medications that can slow bone loss, strengthen the bones, and substantially reduce the risk of fractures, which your doctor can prescribe if appropriate. So if you have osteoporosis, it can be treated to protect you from fractures, but you have to know you have it, which means getting assessed rather than waiting for a break. So ask your doctor about a bone density scan to identify silent bone loss, because if it's found, effective treatments can substantially reduce your fracture risk, and acting before a fracture is the whole point. This is exactly why you shouldn't wait for a broken bone to reveal the problem. Let me be clear about when to see your doctor, because this is largely about proactive prevention. See your doctor proactively to discuss your bone health and vitamin D. Ask whether you should have your vitamin D level checked and take a supplement, whether you're getting enough calcium, and whether you should have a bone density scan to check for osteoporosis, especially if you're an older woman. Have risk factors like a family history, early menopause, certain medications like long-term steroids, or a small frame, or have had a fracture from a minor fall, which is itself a red flag for osteoporosis that should prompt assessment. See your doctor if you've had a fracture from a minor fall or stress, since that warrants checking for osteoporosis. And see your doctor about a stooped posture, loss of height, or back pain, which can indicate spine fractures from osteoporosis. So, the key is to be proactive. Discuss your vitamin D, calcium, and bone health with your doctor, get assessed with a bone density scan if appropriate, and treat any bone loss found, rather than waiting for a fracture. The reassuring message is that this silent danger can be identified and addressed through vitamin D and calcium, exercise and lifestyle, fall prevention, and, if needed, effective medications. So much of the fracture risk is preventable if you act before a break. Let me paint you a picture of how this can go two ways, because the contrast is the lesson. Picture a woman in her 70s who, like many, is quietly low in vitamin D and has been silently losing bone density since menopause, with no symptoms, so she has no idea, and does nothing about it. One day she has a minor fall, the kind that shouldn't break a healthy bone, and breaks her hip, a grave event that leads to surgery, a long, difficult recovery, and a serious loss of her independence and health. The silent bone loss revealed only by the fracture, too late to prevent it. Now, picture the same woman who understands what you now understand and acts proactively. She talks to her doctor, has her vitamin D checked, and starts a supplement, ensures enough calcium, does weight-bearing and strength exercise, and has a bone density scan, which finds early osteoporosis, so she starts an effective treatment that strengthens her bones and reduces her fracture risk, and she diligently prevents falls. When she has that same minor fall, her stronger bones don't break, and her diligent fall prevention may have helped avoid the fall altogether. Same woman, but acting before a fracture, identifying and treating the silent bone loss, and preventing falls made the difference between a devastating hip fracture and continued independence. That contrast is exactly why this matters, and why you must act before a break, not after. And let me speak directly to those of you caring for or close to an older person, because this silent danger is so preventable with proactive action, and you can help. Understand that vitamin D deficiency is common and silent in older adults, and that bone loss, osteoporosis, is silent too, progressing without symptoms until a fracture, often a hip fracture from a minor fall, which is a grave threat to independence. You can help by encouraging proactive action before any fracture, a conversation with their doctor about checking vitamin D and taking a supplement, getting enough calcium, and having a bone density scan to check for osteoporosis, especially for older women, those with risk factors, or those who've had a fracture from a minor fall. You can support the bone-protecting measures, ensuring vitamin D and calcium, encouraging weight-bearing and strength exercise, and good nutrition, not smoking, and limited alcohol. And crucially, you can help prevent the falls that cause most fractures. With the balance and strength work, good vision and footwear, home safety, and the other measures I've discussed, since preventing falls is as important as strong bones. If osteoporosis is found, you can support them in taking any prescribed treatment, which substantially reduces fracture risk. Helping a loved one act proactively to protect their bones and prevent falls before a fracture can prevent the devastating broken bones that silent bone loss otherwise causes, protecting their independence. Let me draw this all together. Vitamin D quietly matters more after 70 because it's essential for absorbing calcium and maintaining strong bones, and for muscle function. Yet, deficiency is common and silent in older adults. Since aging skin makes less, they often get less sun, few foods contain it, and climate limits it. And bone loss, osteoporosis, is itself silent, weakening the bones with no symptoms for years, until a fracture, often a hip fracture from a minor fall, which is one of the gravest threats to an older person's independence and health. Strong, fracture-resistant bones depend on adequate calcium and vitamin D, weight-bearing and strengthening exercise, not smoking, limited alcohol, and good nutrition, while avoiding fractures also depends on preventing the falls that cause most of them. So, protect yourself with a combined approach. Address vitamin D, often with a supplement on your doctor's advice, plus safe sun and food sources. Get enough calcium, do weight-bearing and strength exercise, avoid smoking and excess alcohol, and diligently prevent falls. And because bone loss is silent, be proactive. Discuss your vitamin D, calcium, and bone health with your doctor. Get a bone density scan, if appropriate, to identify osteoporosis before a fracture, and treat any bone loss found with the effective treatments available, because acting before a break is the whole point. So here's what I'll leave you with. First, understand that vitamin D is essential for strong bones and muscle, yet deficiency is common and silent in older adults, and that bone loss, osteoporosis, is also silent, weakening your bones with no symptoms until a fracture, often a devastating hip fracture from a minor fall. Second, protect your vitamin D, since deficiency is so common. Ask your doctor whether you should have your level checked, and take a vitamin D supplement, which many older adults benefit from. And get safe sun exposure and vitamin D foods like oily fish and fortified foods. Third, protect your bones more broadly. Get enough calcium from dairy, fortified foods, and other sources. Do weight-bearing and strengthening exercise like walking and strength training, which genuinely helps maintain bone and muscle. Don't smoke, limit alcohol, and eat well. Fourth, prevent the falls that cause most fractures with balance and strength exercises, good vision and footwear, home safety, and the other measures, since preventing falls is as important as strong bones. And fifth, be proactive about the silent bone loss. Discuss your bone health with your doctor, and ask about a bone density scan to identify osteoporosis before a fracture, especially if you're an older woman, have risk factors, or have had a fracture from a minor fall, because if bone loss is found, effective treatments can substantially reduce your fracture risk. The danger here is silent, both the vitamin D deficiency and the bone loss, so the whole point is to act before a fracture, by protecting your bones and identifying any loss rather than waiting for a break to reveal it too late. So, take care of yourself, protect your vitamin D and bones, prevent falls, and be proactive with your doctor. And because checking vitamin D, assessing bone density, and treating osteoporosis require a doctor, please treat your bone health as your reason to have a proactive conversation with your own physician who can check, advise, and treat, rather than as a substitute for that care.